Welcome to our third episode of Psych Snippets. I'm Dr. Brittany Hayden.
And I'm Dr. Sally Richards.
And we thought we'd switch gears from talking about self-care to learn a little bit more about COVID-19 and what we're doing at our residential treatment facility to keep our staff and our clients safe and healthy.
We have another one of our doctoral interns, Anthony Nedelman, who is going to be interviewing Jen Zietz, who is the director of nursing for Sarah Reed. And Anthony is a doctoral candidate from Fairleigh Dickinson University.
Thank you for joining us on this episode of Psych Snippets. My name is Anthony Nedelman, and I am one of the doctoral interns at Sarah Reed Children's Center in the residential treatment program. And I'm joined today with Jennifer Zietz. She is the director of nursing at Sarah Reed Children's Center. Jen, thanks for joining us.
You're welcome. Thanks for having me, Anthony.
So we've had a lot of questions submitted about the coronavirus and how is Sarah Reed handling it at the residential campus and just more broadly as an organization. So I do appreciate you taking the time to talk with me about it.
Yes, you're welcome.
So how about we start with the residential campus, because that has a lot of opportunities where sickness can sort of spread. So what can you tell us that Sarah Reed has done to keep the health and safety of our kids at the forefront?
Right now, we have stopped all non-essential appointments and all visits just to avoid any community contact. We've also educated the children on hand hygiene and just are practicing the social distancing, and all the staff have to wear masks.
Okay, great. So everybody on campus,
yes,
the adults.
Yes.
Right? Okay. Are the kids encouraged to wear masks as well?
Yes, they have all been given masks also,
right.
And they are encouraged, and if they ever feel sick, they are to wear that.
Okay. And what can you tell us Sarah Reed has done to protect the workforce? You know, because there's a lot of people involved in the residential campus, the therapists, nurses, social workers, staff that work with kids all day. So what kind of things have been implemented to help keep the adults running the residential campus healthy?
We do the health screenings on all staff before they enter the facility. And if any staff were to feel sick, they are asked to not come to work that day. Maintenance department is also just doing a great job disinfecting the campus, and any high traffic areas, they make sure that that is cleaned on a very regular basis. We also have put posters throughout the whole facility just encouraging hand hygiene and just information sheets about the coronavirus.
Well, one of the things that we've been hearing a lot about in the news is the spread of the virus in close quarter living environments like nursing homes and prisons. And, you know, the residential campus is a close quarter living environment. You know, these kids live very close to one another and the staff have to be very close to one another. So keeping social distancing is really difficult in that setting. I'm wondering if you can talk a bit about what Sarah Reed is doing in the way of contingency planning in the event that the virus were to come on campus and spread to that degree.
Right. Currently, we try and have all the kids have a private room, and they keep each child that's in a unit in that unit, and they try and not go to different units and keep them together just in case that we would need to quarantine that area. So we do have a plan set in place. Our medical director also is working with local hospitals for that as needed basis also, if that would be the case.
Okay. All right, great. Well, it sounds like we really have a lot of things put in place just to make sure that everybody stays healthy and that we don't spread this to anyone else. That's good. It's good to hear.
Yes. Good.
Yeah. We had a lot of questions submitted just about the coronavirus in general, not really related to the residential program. So how about we shift to some of those? One of the things that's difficult is that information keeps changing, you know, sometimes on a daily basis. What can you tell us is the most recent guidelines in best protecting ourselves from catching the coronavirus?
The guidelines given to protect ourselves include maintaining the social distancing, washing your hands often, avoiding close contact with people who are sick, and then just avoiding touching your face.
That can be very hard. Yeah.
Yes. Yeah.
What are some of the symptoms we should be looking out for? I know that the CDC recently added some new symptoms. So what are some of the things we should be on the lookout for?
The key symptoms are a fever, cough, shortness of breath, difficulty breathing, loss of taste or smell, and a sore throat. And if you develop those, you should definitely contact your doctor.
Okay. All right. And I was thinking some of those symptoms look a lot like cold symptoms. So it would be very important to talk to the doctor just to make sure you don't go right to the emergency room, I suppose.
Correct. Yes.
Okay. What can you tell us about what we know about how the virus spreads?
It spreads through the respiratory droplets of an infected person when they would cough or sneeze.
Okay. So there have been some reports about the virus becoming airborne. Do these stories have any merit? Should we be concerned about the virus being now an airborne contracted illness?
Currently, the CDC is stating that the spread of the virus is most likely when people are in close contact under that 6 feet apart. So that's currently what they're marking.
Okay, all right. And within the last couple weeks, the CDC has recommended that individuals wear masks or some sort of cloth face coverings when they're out in the community. If I'm feeling fine, why should I wear a mask?
It's just another additional measure to help reduce the spread of the virus. And it's important because maybe you contracted that virus and you don't have symptoms yet. So just maintaining that safety for other people.
So we never know if we have the virus and haven't quite developed symptoms. And I suppose there's also the subset of individuals who won't develop the symptoms and are asymptomatic. Right. Okay, so it's a way of not just protecting ourselves, but whoever
protecting
else.
others.
Great. Okay.
Yeah.
One thing I was thinking about was, if someone is adhering to their state's stay-at-home orders, their biggest source of contamination is things that come into the home, such as groceries being delivered, packages, the mail, food deliveries. Should we handle these items in any particular way to reduce bringing the virus into the home?
The CDC noted that it may be possible for a person to get the virus by touching surfaces or objects and then touching your mouth, nose, or face, but in general, the risk is low. But you can wipe off the packages with antibacterial wipes and just make sure you wash your hands before you would touch your face or anything after you would touch those items. So just always wash your hands after touching those items.
Okay, so it should be okay to bring in a package, open it, and wash your hands. And you should be all right, it sounds like.
Yeah, it sounds like that, yeah.
That's what the information we're getting now. Okay, that's good. Yeah. I've also been hearing a lot about, especially lately, once the weather starts to warm up, which we're all really waiting for, there's a lot of, whether it's wishful thinking or if there's actual data to support it, I'm not quite up to date on it. There's a lot of people wondering, will the warm weather sort of burn the virus out?
Right now, it's not known if the weather will affect the virus or the spread of the virus, so hopefully we can get more information.
Okay, so we just don't know right yet. Okay. What are your recommendations for people who are watching this at home who may have contracted the coronavirus or may find out that they or someone else in their home has become ill? What are some of the things that those individuals can do once it has come into the house?
The ill person should have a separate bathroom if possible. They should wear a mask, avoid sharing any personal items, and then everyone should always wash their hands as much as they can and try and avoid touching your face.
Okay. I've heard some organizations have recommended to have some sort of backup plan, right? If somebody, a quarantine plan, so to speak, of what you're going to do if it happens, because we
right.
don't know, right? Okay.
Right. Yeah.
Is there anything that members of Erie and the surrounding communities can do to help Sarah Reed with supplies or anything?
Yeah, sure. First of all, we really want to thank everyone and let everyone in the community know how much we appreciate everything that they have donated. It's so helpful, but we can always use more of the cloth masks that have been made that's very helpful for our staff and the clients.
Great. So you have seen a lot of support from the Erie community already up until this point.
Yes, it's been amazing.
That's wonderful to hear. Okay, great. And are there any specific resources that you would encourage people to use to stay well informed in terms of the most recent developments concerning the virus?
I would say the CDC is the most reliable website. That's definitely where I would look if you were looking for anything, and they have information on anything you could think of regarding the coronavirus.
Wonderful. All right, great. So Jen, thank you very much for taking the time to help provide some of the most recent developments regarding the coronavirus. My hope is that this information will help keep people calm and healthy as the state begins to move into the processes of reopening in the economy. So thank you very much.
You're welcome. Thank you so much.
All right, you have a good day and stay healthy.
You too.
Thank you so much, Anthony and Jen, for taking the time to provide us with that education and to reassure us, especially as we're moving forward here in Erie County with some new guidelines about what Sarah Reed is doing to keep us and to keep all of our clients safe, especially as we're moving forward. I hope that you'll join us again next time. And as always, leave us a few comments if you have something that you'd like us to cover. We'd love to hear from you.
Take care of yourselves and each other.
And stay safe.
Bye-bye.